Are nursing students ready to lead the way in breaking the stigma and promoting proper care? Good day! We are the Group 2B of BNPC presenting a research entitled The Knowledge, Attitudes, and Perceptions of Nursing Students Toward Mental Health Services. My name is Prince Joel Pochola Grijaldo, the leader of the group, and with me are my group mates, Eirine Julian Granada, Karollyne Isabella Michelle Guanco, Katrina Beatriz Guerrero, and Kiara Marie Javines.
The study aimed to determine the knowledge, attitudes, and perceptions of nursing students towards mental health services.
With the study's primary objective, the researchers utilized a quantitative analysis with a descriptive correlational research design. This research design is suitable for the study as the study aimed to determine whether there is a significant relationship among the knowledge, attitudes, and perceptions of nursing students towards mental health services when grouped according to profile variables.
As shown in the distribution table, the study involved 278 students from a total of 918 students that were enrolled in the Bachelor of Science Nursing program at the University in Negros Occidental for academic 2024 to 2025. The participants were selected from all year levels, from level 1 to level 4, using stratified systematic sampling based on Sloven's formula with a 5% margin of error. Level 1 had the largest sample size of 85 students, while Level 3 had the smallest with 65 students.
The study made use of a modified standardized instrument adopted from Kihomuro et al. The aforementioned questionnaire consisted of 4 sections, namely demographics, knowledge about mental health, attitude towards mental health, and perceptions of mental health services. The instrument was validated by 3 research professionals with an average score of 4.56 and checked for reliability with a Cronbach's alpha score of 0.855.
For the results and discussion, based on the age, 98.9% of the participants were between 17 to 24 years old, while only 1.1% were aged 25 to 40. Scores of both groups resulted in an average level of knowledge, a very positive level of attitude toward mental health, and a moderate perceptions toward mental health services.
A total of 73.7% of the participants were female and 26.3% were male. Males had slightly higher knowledge scores, placing them in the high knowledge category, while females remained at the average level, emphasizing that while nursing is a female dominated profession, it does not diminish the capability of males to perform as effectively to acquire mental health knowledge at a level comparable to their opposite sex. These findings also suggest that integrating mental health literacy further into the nursing curriculum with emphasis on gender sensitive approaches could ensure a uniformly high level of mental health knowledge. On the other hand, there was no significant differences in attitude scores as both genders demonstrated a very positive attitude towards mental health. Males also had slightly higher perception scores, though both genders were categorized with a moderate level of perception towards mental health services.
Participants were distributed across all year levels, with level 1 students forming the largest group with 30.6%, followed by level 2 with 25.5%, fourth year with 23.4%, and level 3 with 20.5%. While the level 4 participants recorded slightly higher knowledge compared to other levels due to their number of years in nursing education and amount of clinical exposures, the differences were minimal and all groups were categorized as having an average level of knowledge. Based on attitudes, levels 2 and 3 were categorized in the very positive, whereas levels 1 and 4 were under a positive category only. The unexpectedly lower score among fourth year students may suggest the need to examine the quality or recency of their mental health exposure. Notably, level 1 had slightly higher perception scores than the other levels, followed by levels 4, 2, and 3. However, sources of all levels indicated a moderate perception. The results may reflect the growing academic pressures, intensive clinical exposure, or possible disillusionment with available mental health support services that pose a more critical or diminished view of mental health services.
The majority of participants were Roman Catholic with 74.8%, followed by Baptist with 14.4% and other religions with 10.8%. Baptist participants showed slightly higher knowledge about mental illness, followed by Roman Catholics and others, though all groups remained at an average knowledge level. Based on a study, it is reported that Christian communities appear to have moderate to higher levels of knowledge regarding mental illnesses due to their more tolerant attitude towards the mentally ill, associated with reduced stigma. Hence, these groups are more open in receiving and listening to mental health educations, campaigns, and initiatives. There were no significant differences in attitude, with Roman Catholic and Baptist participants showing a very positive attitude, while those from other religions demonstrated a positive attitude towards mental health. Students from other religions had marginally higher perception scores, but all groups were categorized with a moderate level of perception.
34.9% at least 5 sources of mental health information, followed by 25.5% with 3 sources, 24.1% with 4, 12.6% with 2, and 2.9% with just 1. Participants with only one source showed a high level of knowledge, while those with 2 or more sources had an average knowledge. While minor differences were observed in the attitude levels of the participants towards mental health, all groups demonstrated overall positive to very positive attitudes. The findings emphasize the importance of implementing more awareness policies across different media to address negative attitudes and reduce the stigma surrounding mental health and its services. On the other hand, regardless of the number of sources, all participants exhibited a moderate level of perception towards mental health services.
As a whole, the study found the following. The total mean score for knowledge was 11.36, indicating an average level of knowledge towards mental health. The participants had an average mean score of 4.53 for attitudes, reflecting a very positive attitude towards mental health. For perceptions, the mean score was 2.79, indicating a moderate perception of mental health services.
The chi-square tests revealed no significant relationship between nursing students' knowledge, attitudes, and perceptions toward mental health services based on their profile variables, with some exceptions. Significant associations were found between knowledge and sex, with p equals 0.003, and knowledge and religion, with p equals 0.033. Age, year level, and sources of mental health information showed no significant relationship with knowledge. For attitudes, a significant relationship was found only with the source of mental health information, with p equals 0.028, while no other demographic variables showed meaningful associations. In contrast, no significant relationship was found between perception and any of the profile variables.
First, the correlation between attitude and perception is rho equal to negative 0.045 with a p-value of 0.450. This means there is a very weak negative relationship between the two, and it is not statistically significant. Next, we look at attitude and knowledge. Here is rho is equal to negative 0.085, the p-value of 0.157. Similarly, the relationship is weak and negative, and it is also not significant. Lastly, the correlation between perception and knowledge is rho equal to 0.109 with a p-value of 0.070. While this is slightly stronger positive relationship, it still does not reach statistical significance. In summary, the results show that there are no significant correlations among attitude, perception, and knowledge. This implies that acquiring higher knowledge about mental health and its services does not necessarily correspond to a more positive attitude and perceptions among nursing students.
For the conclusion, first and second null hypotheses were rejected. Knowledge was significantly related to sex and religion. Attitudes were significantly related to the source of mental health information. Third null hypothesis regarding perception was accepted. No significant relationship was found with any profile variable. Fourth null hypothesis was accepted. No significant relationship was found among the knowledge, attitudes, and perceptions of nursing students toward mental health services. The findings underscore the need for enhanced mental health education within nursing programs to foster a more informed and supportive approach to mental health care.
For the recommendation, based on the study's findings, it is recommended that school administrators enhance mental health education and awareness to improve knowledge and reduce stigma, while training staff to respond to student needs. Guidance and evaluation officers should strengthen counseling services through workshops and sessions that also promote positive attitudes. Clinical instructors are encouraged to integrate mental health topics into discussions and guide students to be advocates Nursing students should actively engage in mental health programs to apply their knowledge and influence perceptions. Researchers are advised to assess the long-term impact of interventions and how knowledge affects attitudes. Future researchers should also explore the link between personal experiences and attitudes and conduct comparative studies for broader insights.
This wraps up our study titled The Knowledge, Attitudes, and Perceptions of Nursing Students Toward Mental Health Services. For the references, you may scan the QR code found on the lower right side of the screen. Thank you for listening.